number of measles cases in southwestern Ontario is now officially being called an outbreak. The Southwestern Public Health Unit and Grand Erie Public Health Unit are reporting a combined 20 cases, mostly in children. Officials say caseworkers are focusing on following up with possible close contacts after a significant number of exposures in local healthcare settings. Most of the infected people were not vaccinated. Canada's Chief Public Health Officer is expressing concern about increasing measles cases in Ontario and Quebec. And CTV's Kamal Karamali joins us now with more. Good morning, Kamal. What is the latest on measles in Canada, and where are the outbreaks?
Yeah, so these 19 cases in southwestern Ontario, Renee, adding to an already growing number of measles cases across the country, especially to end 2024. We saw a sharp rise in not only Ontario and Quebec, but in New Brunswick as well. So taking a look at some of the numbers we saw in 2024, you'll see on the left of your screen there, 146 cases in 2024. And then on the right of your screen, you can break it down by the provinces, most of it concentrated in 3 provinces, 38 in Ontario, 57 in Quebec, and 47 in New Brunswick in 2024. And below that number of 146, you can see what it was like in previous years. Just to compare, in 2023, you only saw 12 cases. The year before, 3, none in 2021, and 1 in 2020. And it hasn't topped 100 since back in 2019. So just giving you a snapshot of what it's been looking like in 2024 going into 2025. Once again, 19 cases in southwestern Ontario in Grand Erie Public Health and Southwestern Public Health. And 16 of those are children, 3 adults. Have a listen to what one health professional in that area had to say about some of the demographics of some of these cases that have now cropped up.
Our cases are, I would say, predominantly in the under-vaccinated population, and most of those are going to be non-vaccinated. So a lot of them are, as I say, a lot of them are children.
And Renee, prior to this most recent outbreak, adding 19 new cases, the Health Canada website only has the first 2 weeks of January listed, and there were 8 cases. So now you add, 19 more to that 8, and we're at roughly 27 or so cases in 2025 already. So a sharp increase here.
Oh, dear. So what guidance is coming from Canada's Chief Public Health Officer?
Yeah, so the Chief Public Health Officer, Theresa Tam, sent out an advisory this week saying that international travel is the main reason for the initial outbreak, and we know how contagious measles are. So it didn't take too long for these international travelers to come back home to Canada and then see that spread take place. The symptoms you're looking out for, just a quick reminder to our viewers, is red rash, fever, cough, runny nose, red eyes, and fatigue. And someone can be contagious from 4 days before to 4 days after. Now, Theresa Tam also said the majority of the cases among those are among those who are not vaccinated, most of them children, saying she's concerned the vaccination rates aren't high enough. And data shows, Renee, that there has been a decline in measles vaccination coverage in children in 2023 compared to 2019 rather. So, just a reminder from public health here to get vaccinated as well. And as well as if you are traveling outside of the country, because we know outbreaks are also happening in Europe, to make sure your children are vaccinated before you do any traveling, especially in European nations.
Okay, CTV's Kamal Karamali reporting. Thanks for this, Kamal.
You're welcome.